So in this video lesson, we're going to look at the respiratory system, which, as you've known since you were a small child, is responsible for your breathing. And yes, you've also been told on multiple occasions that we need oxygen to survive. And that's true. However, what's very interesting is that there's nothing in your body that can measure how much oxygen you have. Your medulla oblongata is the part of the brain that's responsible for breathing. It is a pH regulator. So it is actually monitoring the pH of your bloodstream. And when your pH of your bloodstream gets acidic, it tells you to breathe. So your body actually monitors how much carbon dioxide you have. When carbon dioxide mixes with water, it creates carbonic acid. So the more carbon dioxide that builds up in your bloodstream, the more acidic your blood becomes, and your brain tells you to breathe out. So in this video, like I said, we're going to look at the respiratory system. So just some terms to make sure you know the difference between. Okay? First of all, pulmonary respiration. This is what we call breathing in and out. Remember, anytime you see the term pulmonary, that is referring to your lungs. This is not inhaling and exhaling. Okay? It is pulmonary respiration. Along those lines, you have external respiration. External respiration is not breathing out. Okay? Remember when we talk about the respiratory system, we are looking at the exchange of gases. We're looking at oxygen going into our bodies so that our bodies can make ATP, and we're talking about carbon dioxide, which is an acid, a waste product, leaving our bodies. Well, this happens in two places, this gas exchange. This gas exchange can happen in our lungs, and this gas exchange can happen in our capillaries. So we have to be able to differentiate between the two. So when we look at what we call external respiration, this is not breathing out. External respiration is the gas exchange between the lungs and the blood. Keep in mind that your brain is trying to get rid of carbon dioxide because carbon dioxide is an acid. Yes, we breathe because we need oxygen, but at the same time, we breathe to get rid of carbon dioxide. And your medulla oblongata is frantically trying to get rid of carbon dioxide. So in external respiration, think of external as out, but what's happening is the carbon dioxide is leaving our bloodstream. So this happens between the lungs and the blood. This is where oxygen will enter your bloodstream, and this is where carbon dioxide will leave your bloodstream. At the same time, we have internal respiration. This is not breathing in. This is gas exchange happening at the capillaries, so between the blood and the cells. This is where oxygen will leave your bloodstream and carbon dioxide will come in. So if you think about respiration in regards to what's the carbon dioxide doing, because that's the acidic waste product we need to get rid of, these terms will make a lot more sense. So with external respiration, the carbon dioxide is coming out of the blood. Internal respiration, that carbon dioxide is coming into the blood. Now, when we look at the respiratory system, we actually divide it into two parts. We have what we call the upper respiratory tract, and we have what we call the lower respiratory tract. Okay? So you might have heard of people having an upper respiratory tract infection. Well, basically this is your nose, your mouth, and the and your pharynx, the top portion. Your lower respiratory tract is going to be the tubes like your trachea, your bronchi tubes, your bronchioles, and the actual lungs themselves. So in the case of the upper respiratory tract, you can see here different functions that we have. First of all, your nose is included in this. And you know that your nose is the passageway for respiration. Well, your mouth is also considered to be part of your respiratory system because you know that we can breathe through our mouth. Because our pharynx, which you guys call your throat, is actually shared by the respiratory system and the digestive system. So we can breathe through our nose, we can breathe through our mouth. Nature prefers us to breathe through our nose because we have more surface area in our nose. We have two nostrils. We have a wall called the septum. That's what gives us a left side and a right side. So we can have more mucus in our nose, and we have nose hairs called vibressa so that we can filter more. Also, your nose is where we find our olfactory hairs, which are little nerves that allow us to smell. Now, our lungs, think of our lungs as soap bubbles. They're made from simple squamous tissue, and they're incredibly, incredibly delicate. And therefore, we have to be real careful with trash getting down inside of it. So again, like I mentioned, we have the upper respiratory tract, our nose, we have mucus in our saliva, we have a little bit of mucus in our pharynx. It's going to help trap trash. And we also have these little vibrissae, things like cilia in our trachea to help trap all this trash so it doesn't get down into our lungs. Imagine having a piece of sand rolling around inside of a soap bubble. You know it's going to pop. Also, we have to make sure our lungs don't dry out. In order for gas exchange to take place through a tissue, that tissue must be wet. So therefore, by breathing in through our nose and through our mouth, that air mixes with water. It gets moist, and it's going to help keep our tissues from drying out. And at the same time, our trachea, the top part of our trachea, the larynx, our voice box, is considered to be part of the upper respiratory tract. This is responsible for making our sounds or our voice. So again, you can see in this picture, we have our nose. And in the case of our nose, you can see we have what we call the external nose, and we also have what we call the internal nose. What you call your nose is your external nose. What a lot of people call the sinuses are sometimes considered to be part of the internal nose. So speaking of that, like I mentioned with your external nose, is what you see when you look at your face. Nature has given us a vomer bone. If you remember the lessons about the bones of the skull, we have a vomer bone, a C-shaped bone, very deep down inside of what you would call your nose. And we have a piece of hyaline cartilage that attaches to that. And that piece of hyaline cartilage is called your septum. And this is what gives us two nostrils. By having two nostrils, that allows us to have more surface area. We can have more mucus to trap trash. We can have more vibrissae or nose hairs to trap trash. And it is also going to help moisten. So in the case of your external nose, you guys know its job is to filter and warm the air. Well, also when we talked about the skeleton and we looked at the skull, we looked inside the nose. And we mentioned we have these folds of bone inside of our nose. And these folds of bones are what we call the nasal conchae. They're also called the turbinates. And you can see them labeled here on this diagram. You can see the superior, the middle, and the inferior turbinate. Remember, anytime you have folds, you increase surface area. So by having a fold, we can have more mucus, we can have more nose hairs, so we can do more filtering. The internal nose is often considered to be the sinuses. Now remember, sinuses are openings we have inside of a bone that cannot be seen from the outside, but you all know we have sinuses. We have sinuses above our eyebrows. We have sinuses, you know, in what we would call below our eyes and our cheeks. And a lot of times these sinuses are there to help that bone weigh less. Okay? It can also, in like the case of our bones, we have bone marrow, and the sinuses are the openings in our spongy bone to help hold the blood and to hold the fat, to hold the bone marrow. In the case of your skull, these sinuses are going to help also warm the air. Now, when you breathe through your nose, you can take a deep breath, and you can feel air go into your mouth. You can also breathe through your mouth. Well, if you remember, the very back area of your mouth is called the pharynx. It's what we call your throat. It is shared by your digestive system and your respiratory system. And a lot of people don't realize that your throat is not a tube. For some reason, we think if we were to shine a light and we would see this long, dark tube going down. And that's not the case. Our pharynx is actually divided up into different parts. The first part of our pharynx is what we call the nasopharynx. This is basically where your nose drains into your throat. You actually have two openings on the roof of your mouth. They're what we call the internal nares. And this is how air goes from our nose into our throat. This is also, for example, you know that mucus is constantly dripping from your nose into your mouth and you swallow it. You know, you can sniff. The mucus comes from your nose into your throat. Well, it's going to pass through these things called internal nares. This is also where we find our eustachian tubes. Eustachian tubes are found on both sides of our mouth, and they are passageways that lead up into our ear, and they're going to help with ear pressure and balance. Now, like we mentioned, your throat is not a continuous tube. It actually kind of dead ends in the back, and I'm going to show you a video in a minute that gives you a better idea of what this looks like. You actually have two openings in the back of your throat. One opening is called the glottis, and one opening is called the gullet. They're not open at the same time. Your glottis is the opening that leads to your trachea. So it's kind of like your breathing hole. And that one is open most of the time because you breathe more than you swallow. The opening to your esophagus is called the gullet. And there's a little flap called the epiglottis that basically controls these openings. Which then leads us to what we call the lower respiratory tract. The lower respiratory tract is a series of tubes that goes down into your lungs. We have the larynx, which is what we call your voice box. We have the trachea, which is your windpipe. And your trachea will then split into two tubes called a bronchus tube. You have a left bronchus and you have a right bronchus. The bronchus tubes will then continue to split into these smaller tubes called bronchioles. And each bronchiole will have these little like soap bubbles at the end of them that we call alveoli. I always consider the lungs to be like a cluster of grapes. You know, you can go to the store and you can buy a cluster of grapes, and it tends to be in a bag of some type. Well, our lungs have a bag around them. They have a membrane around them, and that's going to be called the pleura. And you can reach into that bag, and most of the time a cluster of grapes will have one main stem. Well, that one main stem would be the bronchus tube. And coming off those bronchus tubes, you have all the other little stems. Well, that would be like the bronchioles. And then attached to each bronchiole, you have all these little grapes. And each grape has its own stem. Well, you're going to see that that's called the alveolar duct, and the grape would be like the alveoli. Now, some people consider the larynx or the voice box to be part of the upper respiratory system, and some people consider it to be part of the lower respiratory system. I'm just going to kind of talk about it as the in the middle. The larynx is what we commonly call your voice box. It is considered to be the top part of your trachea. And what a lot of people don't realize is that it's not cords when we talk about vocal cords. This is also what people call your Adam's apple. And there's a reason why guys' Adam's apples stick out more than ladies. And we're going to talk about that here. Okay. But like I mentioned, this is made from hyaline cartilage. It has to be flexible because we have to be able to move around, but at the same time, we want to make sure it doesn't close. Imagine every time you bent your head, it would be like taking a garden hose and pinching it off. You wouldn't be able to breathe. Okay. It functions in phonation, which is sound production. And again, your vocal cords are not cords, as you can see here. It's actually two flaps of muscle that open and close. Think of it as the top of a balloon. You know that you can like squeeze the top of the balloon really tight and just a little bit of air comes out and it's this high-pitched squeal. Well, your vocal cords work the same way. Based on how wide this opening is, right here, okay, that's going to determine the sounds that you make. The tighter or the smaller that opening, the higher pitch that sound's going to be. And the further you can spread your vocal cords apart, so the bigger the opening, the deeper the sound is. Because what creates the sound is how these vocal cords vibrate. Now, as children, we all sound pretty much the same. You know, if you're in a room with a bunch of kindergartners, you would actually have a hard time figuring out, does that voice belong to a boy or does that voice belong to a girl? Well, as we get older and boys hit puberty, they make testosterone. Testosterone can actually cause muscles to thicken. That's why boys look like they have bigger muscles than girls. Well, when the muscles thicken, that can cause the muscles of the voice box to thicken. Well, that's going to push out the hyaline cartilage, which is going to give them a larger Adam's apple. And so boys can tend to have deeper voices because they have more room to open up those vocal cords. They are going to lead again to your trachea, which is commonly called your windpipe. And again, some people consider this to be part of the upper respiratory system. Some people consider it to be part of the lower, but it is a tube surrounded by hyaline cartilage. And again, that hyaline cartilage is there to make sure that this tube stays open. The last thing we want to do is have this tube peristalse and pulse and open and close, because you would not be able to breathe. It is lined with mucus in order to help filter and warm the air. And it's also lined with pseudostratified ciliated columnar cells. Basically, if you were to cut open the trachea and look at it underneath the microscope, it would look like a caterpillar. It is fuzzy. And that cilia is constantly beating, and it beats upward. So any trash that happens to make it down into the trachea gets swept right back up to the top, and it gets swallowed. This is why sometimes in the morning you have to clear your throat and your voice might sound a little groggy. Oh, let me go back to the windpipe, the larynx for a minute. Sometimes the larynx, the vocal cords can swell and that can lead to laryngitis. So you can't open and close them like they're supposed to. When you have a cold, you can get a lot of mucus built up on your vocal cords so they don't vibrate like they're supposed to. That's why your voice sounds funny sometimes when you're sick. And sometimes in the morning when you first talk, your voice might be a little groggy. That's because all night long, the cilia has swept all this trash up and it might be sitting on your vocal cords until you have a chance to clear your throat. When you clear your throat, you cough all that trash back up into your mouth and then you just swallow it. And you're like, oh, that's grossing me out. Well, you've been doing it your whole life. And your stomach acids take care of it. Now, there is something called smoker's cough. You might have heard of that. It's like that really deep hacking that smokers do. And sometimes it sounds like they're going to, no pun intended, cough up a lung. Well, when you smoke, even vaping has very dangerous chemicals in it. And you know that cigarettes contain tar. Even the chemicals in vape contain tar. Well, think of it this way. Tar is tar. We use tar to pave roads. We use tar to create asphalt. Well, cigarettes and vaping chemicals contain tar in them. So you can actually form a hard crust that covers your trachea. Well, that hard crust is going to trap the cilia, and the cilia cannot sweep up trash. So that trash is going to gather in your lungs. You can also create a crusty substance inside of your lung tissue itself. And cigarette smoke is hot. It can also burn these little cilia. So in this case, people who smoke for long periods of time, they've kind of literally paved their tubes. And so they have to have this really deep, nasty sounding cough in order to get all that trash up. Which then leads to something called a tracheotomy versus a tracheostomy. Now, some people will use these interchangeably. There is a minor difference between the two. And anybody who's going to go on to med school or become an ENT or a paramedic, one of the first things they're going to do is teach you how to do a tracheotomy. And they're going to tell you to bring clicker pens, not a big ballpoint pen, but clicker pens that you can take apart. Because you'll be amazed, you can actually do a tracheotomy using a clicker pen. But in the case of a tracheotomy, this is an incision made into the trachea in order to ensure breathing. So if somebody is choking or they have they've damaged their larynx, you can actually go in and create an opening in between the pieces of cartilage so that these people will start to breathe through that opening. But you got to keep that opening open. So you can actually use something like a clicker pen. You can take it apart, you can put it in that opening, and that person will begin to breathe through that opening. Now, you're like, okay, that's gross, that's not very sanitary. No, it's not. And most paramedics and people like that will have tracheotomy kits available to them. However, in dire circumstances, don't worry about the infection. We can take care of that with antibodies. You need to make sure that this person keeps breathing. Now, the actual incision is what's called the tracheotomy. Whatever you put into it can lead to what's called a tracheostomy. Now, tracheostomy tends to be a permanent opening. This is where they have to, you've seen those people that have these openings in their neck. Now, how they learn to talk like that, I don't know. But a tracheostomy tends to be a permanent opening. The tracheotomy is the incision, and hopefully it's just kind of, it's temporary until you can get to the hospital and get whatever's causing the blockage taken care of. But some people, they have to have pieces of their trachea removed due to cancer, or they just might have damaged their trachea so much that they actually have to have this permanent opening. So let's take a look at this video that explains to us how the respiratory system works. And that is What's Up, Dude. Thank you for letting me use your video.